Proprioceptive neuromuscular facilitation, or PNF. So let's first define what PNF means. So proprioception comes from two words, from the Latin term proprius, meaning one's own, and from the English term ceptive, or as from receptive. So if you literally translate it as such, it would be proprioception, one's own reception, or one's own receptive. Essentially, proprioception is how your body or you know which part of your body is moving in relation to space and time. So if even if you close your eyes, you would know that you're moving. Let's say you wiggle your fingers, you would know which finger is moving, which finger is straightening or flexing, or which finger is performing abduction or adduction. That's what proprioception means. Proprioceptive neuromuscular facilitation is one of the most used therapeutic exercise modality among stretching and joint mobilization techniques. It applies the concept of reciprocal and autogenic inhibition. So let's go to the next slide to recall the concepts. So reciprocal and autogenic inhibition. This refers to the relationship between receptors and motor outputs and how they all work together. For reciprocal inhibition, this occurs when they're in a muscle, right? When you perform a movement, there are two types of muscles that are related to that movement. You have the antagonist and the agonist. Let's use an example. Let's say the elbow flexion. When you perform elbow flexion or moving your forearm towards your upper arm, the agonist, the main actor of the movement, would be the biceps brachii, since it is responsible for elbow flexion and can also assist in shoulder flexion, since it is two jointed. But it is the main mover of that action. However, there is also the antagonist on the other side, posterior aspect of the upper arm, the triceps. When you move the elbow into flexion, the biceps would contract. However, due to reciprocal inhibition, this causes the antagonist, the triceps brachii, to relax, allowing for more movement in elbow flexion. The receptor for this movement is called the muscle spindle here. Moving on to autogenic inhibition. Autogenic inhibition, basically it's like when a muscle experiences too much tension, this this inhibition would relax that muscle. And the receptor for this would be the GTO, or the Golgi tendon ergans. So let's say you are stretching your hamstrings, or you're performing hip flexion to stretch your hamstrings. If there is too much tension within the quadriceps as you perform hip flexion, since quadriceps is the agonist of that movement, it is the prime mover, it is responsible for hip flexion and knee extension. And if it experiences too much tension, it could cause relaxation of the quadriceps. So I hope you understand those two terms. If you don't, maybe you could refer to another video, one of my other videos, which discusses them in more detail, since it is an integral part in understanding how PNF stretching works. Okay, so let's go to PNF. PNF has two criteria for it to be done on a patient. Firstly, the muscle that you are trying to perform PNF upon should be innervated. Secondly, the patient is able to voluntarily contract the muscle, because PNF involves the patient's help too. This is not like gentle passive stretching or passive range of motion where only the physical therapist performs the movement for the patient. The patient has to be able to achieve some level of AROM. So there are three types of PNF stretching which we will be discussing. We have the hold relax, contract relax, and agonist contract. In some resources, they refer to hold relax and contract relax as one, but in this video we will be referring to them as different types, because you can't really differentiate it, but essentially they're also the same. But Okay, for this video, let's just refer to them as different types of PMF. So let's go first to the hold relax technique. So how I remember this is I use this statement: contract and hold, relax, lengthen. So what do I mean by that? So in the hold relax technique, as obvious from its title, hold, relax, you contract the tight muscle for 6 seconds before stretching the tight muscle for 15 to 30 seconds. So it would be difficult to understand these techniques without an example, and we will be providing an example. So hip extension contracture. When you say hip extension contracture, which muscle is tight? The hip flexors or the hip extensors? The hip extensors. Why? Because in a hip extension contracture, it would refer to a tightened muscle, and it's the hip extension. However, if your hip extensors are tight, what range of motion, what movement is limited? Hip flexion. So let's see, look at the picture here. So if my hamstrings are tight, the quadriceps femoris would have limited hip flexion due to the contracture of the hip extensors. Okay, so let's define then which one here is the agonist and which one here is the antagonist. So again, agonist is the prime mover. In this movement, you see this woman here, what is she performing? She is pushing her leg, or at least moving her leg in a hip flexion. Let's disregard this other woman here for now. Let's focus on this woman. She's performing hip flexion, meaning moving the hip towards her torso. So that quadriceps femoris is the agonist of this movement, and the antagonist is the hamstrings. Okay? Now, we have defined which muscle is tight. We have defined which muscle is the agonist and which muscle is the antagonist. Now we decide which muscle should we contract for 6 seconds. As I mentioned earlier, we contract and stretch the tight muscle. And what is our tight muscle in this scenario? Is the hamstrings here. Okay. But then you're looking at, but why is she performing hip flexion if you want to contract the extensors? Well, I will explain that to you in a second. Okay, before I explain it, disregard this hand. I couldn't find an image, or at least I was too lazy to search for a more specific image. But just disregard that hand, okay? Just focus on this hand. And pretend this hand is on this bulk of the leg. I am so sorry. I know it's confusing. But okay. So, contract and hold is the first part of the hold relax technique. In this position, I want to contract the tight muscle. I want to contract the tight muscle. The tight muscle is the hip extensor hamstrings. Okay, so how do I contract it? In the hold relax technique, it utilizes isometric contraction. From the name itself, isometric, meaning you're holding it in position. That's why it's called the hold relax technique. Because when the muscle is contracting, it does not change in length. It simply contracts and holds in one position, like static stretching. So here, I would ask the patient, okay, ma'am, could you please try and move your leg, push it towards me while maintaining a straightened leg, and I will apply resistance to your leg. So try and hold it for 6 seconds. So the patient would try and push it towards me. I would try and resist that movement, and then we would stay in that position for 1, 2, 3, 4, 6 seconds. Afterwards, I would stretch that tight muscle for 15 to 30 seconds. Okay, which is the tight muscle? The hamstrings. So how do you stretch the hamstrings? When you stretch a muscle, it has to be in a lengthened position. So this is actually the lengthened position of the hamstrings, because since the agonist quadriceps is shortened, it is in a shortened position here, then that would mean the hamstring is the antagonist is in a latent position. So you, after the contraction and holding for 6 seconds, ask the patient to relax. Okay po ma'am, please relax the muscle, and then you would push, and then you would stretch the hamstrings for 15 to 30 seconds into a new range of motion. Okay, so that might be a bit confusing. So let's add explanation of the autogenic inhibition. How does autogenic inhibition come into play in this scenario? Well, when you first ask the patient to push their leg towards you, that movement is hip extension, right? In hip extension, the hamstrings are the agonist. Okay, and it's getting confusing. But agonist. In hip extension, the hamstrings is the agonist. In hip flexion, the agonist is the quadriceps. Let's focus on the hip extension. So in hip extension, hamstring is the one performing the movement, therefore it is the agonist. Ask the patient to push the leg towards you. Now, when you perform an isometric contraction, this would increase the tension within the agonist of that movement. Since in hip extension, the hamstring is the agonist, the hamstrings would experience an increased amount of tension. That's why you're holding the position for 6 seconds, so that the Golgi tendon would sense the increase in tension and then would therefore, due to autogenic inhibition, would relax the hamstrings. Making sense? Hopefully. So once the hamstrings is relaxed, you then ask the patient again to just not move, just relax their leg, then you push. You stretch the hamstrings. Why? Because now the hamstrings is relaxed. You are taking advantage of that autogenic inhibition to allow the hamstrings to stretch even further. Okay? So here some other contractures that you could practice upon to see if you understand. So elbow flexion contracture, and we also have the shoulder extension contracture. So this is the first part of the PNF technique. I will be discussing the other two techniques in another video. So I hope you understand this first technique, and yes, goodbye.